10 million wisdom teeth are said to be removed each year in the United States. That's from the American Journal of Public Health. One family in Maryland says the routine procedure went, well, absolutely awful. The parents of a teenager who died during surgery are now suing. The lawsuit claims that the doctor waited too long to resuscitate the girl after her heart rate and oxygen levels dropped. State investigators apparently found the 17-year-old died after she didn't get enough oxygen while under anesthesia. You said this sort of thing happens all the time, Josh. It's not something that crosses my mind when I go to get a wisdom tooth out.
No, anybody thinks about it. I mean, it's you know, it's things like simple surgeries, and people don't stop. They say everybody does it. It's not going to be me.
Right.
But things do go wrong. So sometimes it's unavoidable. But sometimes there are people who are incapable of handling the job they're handling, and that's why we're seeing a lot more criminal investigations as well, because there's people who are in positions that shouldn't be in those positions because people are dying.
Marcos had a condition called treat your call-in syndrome, and certain precautions need to be followed. The family says they made doctors and nurses aware before the procedure. When they were told Marcos would need to use a gas to keep him calm, his dad showed concern, but says the staff assured him it was perfectly safe and routine. But 10 minutes into the procedure, something went terribly wrong.
He was just had a little pain, but obviously he was unable to breathe and he stopped.
Marcos was rushed to Valley Baptist Medical Center in Harlingen, where doctors were able to revive him, but he stayed in a coma as his parents prayed for a miracle. But Wednesday evening, Marcos passed away, leaving his family heartbroken.
An investigation is underway into the death of a 14-year-old boy less than 24 hours after he had dental surgery.
What started with a trip to the dentist ended with a funeral 3 days later.
Dylan was given the sedative chloral hydrate to make him go to sleep, but says sometime after he was under, he stopped breathing. Hinkle says EMS took Dylan to Shands, where they pronounced him dead after about 45 minutes.
For 8-year-old Raven, it was a routine trip to the dentist for a cavity and a cleaning.
She wanted to have pretty teeth.
5-year-old Diamond needed some cavities filled and teeth capped.
Later that day, she was going to attend a princess party.
But like more than a dozen other children across the country, the trip to the dentist would lead to death.
Who thinks that they're going to take their daughter to the dentist and never bring her home?
There are no safe sedatives or anesthetics. There's only safely administered ones.
Raven Blanco of Virginia died after her dentist gave her what was supposed to be a minimum dose of an oral sedative.
All of a sudden, I could hear an ambulance, and we rushed to the back, and that is when I saw my daughter in the dental chair. They were performing CPR on her.
Is that from the TNA?
But Raven's parents say the dentist didn't know how to save her, and they watched their daughter die 90 minutes later.
I kept saying, Raven, come on back, honey, come on, we need you. We need you to be with us. And she didn't hear me. And then I saw the machine just go from up and down to nothing.
This is something that's being presented to the practitioners, to the dental community, as a very easy thing to do. And nothing could be further from the truth.
We were running an EKG.
Dr. Norbert Kaminsky, a dental anesthesiologist in Michigan, says there has been an explosive growth in the number of family dentists who are using oral sedatives on their youngest patients, many with only a few days training for dealing with an emergency.
45 to 60 seconds might be all the time that they have to save that child's life.
That's a very scary scenario.
Very much so.
But very real.
Very, very much so.